This is Life's About Living. I'm Dr. Page, the best guy to see on the worst day of your life. I have with me a very interesting expert today, Dr. Sal Georgianni. He is a licensed pharmacist. He's been in pharmacy for over 40 years. He's very involved in a lot of different things, including the Men's Health Network. He's going to tell us a little bit about that today. We've got him on the show to talk a little bit about the COVID vaccine. Everyone has questions about the COVID vaccine. Sal, I know you get this all the time. In fact, I was in the office today having somebody work on my computer, by the way, and he was saying, I'm not getting the COVID vaccine. So let's start, first of all, about, we talk about from a physician standpoint, some of the risks and benefits of the COVID vaccine. Let's get your take on this.
Well, it's very simple. I think the vaccine is the only way we're going to find ourselves on the other side of a very, very difficult situation, both personally, economically, nationally. Without vaccines, if you think of what the world would be like if we didn't have vaccines for polio, or if we didn't have vaccines for measles, mumps, rubella, HPV, all the communicable diseases that we can vaccinate against now. Think of what the world would be like. Simply for those of us my age, we can remember what it was like seeing people in iron lungs with polio.
Yeah.
Well, we don't have people sitting in iron lungs with COVID-19, but we were very close in the very beginning where people had to go on respirators, and anybody who knows anything about respirators knows that you become respirator dependent after a very short period of time, a few days, week or so. And the outcome, if you become respirator dependent, is generally not very good. So,
it takes months to get over it. So
if you do, and a lot of these people have a lot of underlying conditions. So, the only way to get on the other side of this communicable disease, global pandemic, is vaccination. Otherwise, we're faced with a scenario where we'll be mitigating for our entire lives.
Yeah, absolutely. And I agree with that. So I do a lot of missions work in other countries, and I've seen people with polio and die of diphtheria, all those things that we don't even see in this country. Right. So, we have a saying, Sal, in Texas, don't take down a fence post until you know why you put it up in the first place. And I think you really got to look back and kind of look at the why. When you lose your why, you lose your way. And I think a lot of people right now are very skeptical of the vaccine, and they don't realize kind of the why of why it's there. We look at other past diseases and the history of past diseases. It really kind of makes sense. Now, I know another thing that you're very passionate about and that you're hearing about a lot as a pharmacist is a lot of people getting the vaccines online. Tell us what you know about that, and tell us about some of the risk of that.
There is no COVID vaccine online, what people are exposing themselves to. And I understand the rationale. People are frustrated because the systems to register to get vaccinated are not functioning the way we would like. They sometimes are very difficult to maneuver, particularly for folks who most generally able to get the vaccines now, folks 65 and over. And they haven't begun the general distribution through legitimate channels, pharmacies where they can be given. So I think there's a lot of frustration, and people are turning to the internet. I know FDA, at last count, there are over 500 different bogus sites trying to sell COVID vaccines. Don't do it.
Wow.
These people don't care whether you live or whether you die, whether you have a false sense of protection. These are not legitimate. So all the vaccines that are coming straight from Moderna and Pfizer and then the other couple of manufacturers. They're being allocated out by the federal government to the states, and the states are not getting them out to the internet.
So let me ask you another question about that, Dr. Sal. So you're saying that you can order this and they send you like some kind of placebo or something through the mail?
Through the mail. And I think people are being fooled because we also see vaccines being produced in China, Russia.
Right.
They're creating some in India. And these are notoriously global bad players in the pharmaceutical sourcing market.
Right.
A lot of bad medicine comes from these people.
Right.
They sneak fentanyl into other products, and we've seen people become deathly ill, literally, and helping, amass a tremendous addiction issue. So the issue of counterfeit drugs is a big moneymaker.
Absolutely.
Just don't get it.
Yeah, I think that's a great advice, Dr. Sal. You know, it's funny. I even had a patient today asking about the Chinese vaccine. I mean, because everybody hears that it's 99% efficacious or whatever. So I agree. You know, I mean, the quality control, it's never perfect in the United States. You know, once again, that's why we've had a year to get it done. But the quality control is so much better here than it is in other countries. And that's a real problem when we're getting, you know, all these medications and things from other countries. Tell us a little bit about what you know about that, Dr. Sal.
The medicine supply in the United States has never been as porous and as loose as it is now.
Really?
This is a problem that's developed over 20 years, more in the making. And it's all driven, unfortunately, by this vision or this view that we can bring pharmaceutical products down to the commodity level.
Right.
What has happened is a lot of manufacturing has gone offshore into places where the Food and Drug Administration, which is the sine qua non, the premier regulatory authority in the world, has the ability to go into the plants and inspect the plants. They also can't inspect the materials that go into making the medicines. Right. So the raw materials are coming from places, quite frankly, where you wouldn't want to drink the water. And being manufactured in places which have very poor quality control. And
scary, isn't it?
Very scary. And, you know, I'm sure you know as a clinician, and I've seen it many times when I worked at one of the Air Force bases here doing medication management for some of the patients, that people were just not getting better the way you would expect them to be getting better.
Right.
They get the prescription 1 month, and all of a sudden, you know, the next month it's not, their blood pressure is not looking so good, or the diabetes control is not looking so good. And you never really know because you don't do batch certification, but a lot of us, me included, suspect that as they change from lot to lot to lot, the consistency in the potency, the amount of medicine actually in there, and the amount of medicine that actually gets into your system can vary a lot. So
that month their budget was just a little low, so they decided, hey, we're going to skip on a little bit of this.
Yep. And the next thing that we're seeing, which many of your patients and people have heard about, is impurities, cancer-producing impurities in medicine.
Blood pressure, like Zantac.
Right, exactly, Zantac. You know, we had this kind of a scare with dog food about a decade ago.
Yep.
Coming from China. And what's incongruent and unbelievable to me, Dr. Payne, is that people got more upset with the contaminated dog food than they got upset with the contaminated medicines.
Yeah,
I don't understand it.
Yeah, we live in a messed up world. So what's the answer to this? I mean, so why is the United States, I mean, knowing that the quality of these medicines is not as good from other countries, and there's quality issues, why have we outsourced all this?
It costs, you know, and the fact that it's no longer commercially viable for large companies to make a tablet that they sell for a penny.
Right.
It's just not commercially viable. Also, the need to buy cheap raw ingredients from overseas sources is also driving some of that.
Right.
So one of the things that Trump started, and we also see coming from you know, the Biden administration, is this whole notion of buying American-made materials and products. And, you know, we're seeing that, excuse me a second. Oh, sorry. We're seeing that play out across the country where they're trying to gear up production of raw materials. That includes for the COVID vaccine, because they've had trouble in the very beginning getting raw materials for the vaccine. That's where we saw a little bit of a drop off. So in order to get up to full capacity, so that the United States, and then also in Europe, where they do have good regulatory oversight, it's going to take a 10-year process, according to a lot of the industry analysts. Thank goodness it's recognized. Thank goodness it's being started now, but it's going to take a while to straighten it out so that we have a good, tight, effective, and pure medication supply.
Right. It's interesting. There's going to be there's always good things that come out of something bad. For example, all of the wars that America went through, we learned a lot from trauma and from medicine and from surgery. And I think we're going to learn a lot. It may take 10 years to figure all this out, but I think we're learning a lot about medicines and how we get medicines and things that's going to change, hopefully, the future and the way that we treat diseases. And I think quality controls is one of the things that I think we've kind of thrown all that out the window. And, we just kind of have assumed that these other countries would be, doing a good job. And they're really kind of just, they're skimping on things that we would consider priority. Dr. So I want to change directions here. And I want to ask you a little bit about the Men's Health Network. You can find a little bit about the Men's Health Network at menshealthnetwork.org. But tell us a little bit about your involvement in that and a little bit of the services there for men and men's diseases.
Men's Health Network's been around for about 27 years now. It's the oldest and largest organization that does education and advocacy for the health and welfare of men and boys and their families. We try to reach out to the guys where they live, work, play, and pray. We bring programs for, when we can do programs again, out to everywhere from faith-based communities to barbershops to support civic organizations such as Lions and Rotary.
Yep.
We're very much involved with the Rotarian Physicians International Group. We have a broad range of informational materials. For example, we have a book, very popular book, Blueprint for Men's Health. We have a lot of material that we've done in collaboration with one of our supporters, PCORI, which is the Patient Outcomes Research Institute. They fund a lot of our work at Men's Health Network. We have programs on prostate cancer, testicular cancer recognition and screening for boys and men. We even have a great brochure, most of it's all free, on what women need to know about men's health. And it's so important.
It is good.
Today continue to be the driving force in providing health for those around them. And sometimes women don't understand why men won't go to the doctor, or why men who are depressed or anxious exhibit their depression and anger, their depression and anxiety differently than the gals do.
Right. Well, for example, and most the audience may not know this, but men can go into menopause, and it's very different than female. Female menopause, they kind of hit the cliff and they just, they have the changes. Men, it's more of a slow, gradual thing. And so that's one of the things about low T. And so I'm sure you have a lot of information about that on menshealthnetwork.org that you can find. Sounds like you've got a lot of resources for men to actually learn to educate themselves. And I think that's the first step. Don't you, Dr. Sal?
Yep. Education. And the guys have to take a page out of the women's healthcare playbook, if you will.
Yeah. So I
think advocate for their own health and they speak up.
That's a very needed resource. So I want to thank you for being on the show, Dr. Sal. And this is the first of 2, maybe 3 episodes that we're going to try to get out of Dr. Sal today. He's a busy guy, and you can find these also on our website, which is lifesaboutlivingshow.com, or you can text LAL to 66866, and that will connect you with the rest of our podcast and our blog and our TV show. Dr. Sal, it was great having you on the show today.
Thanks for having me on. I enjoyed the discussion.
Absolutely.